So yes, my name is Debby Jones, and I'm the director of YouthThink. And most of the things that we do at YouthThink, we're really trying to promote the protective factors that help people, young people, maybe choose not to use substances. But what's really important about that whole continuum is every life matters, no matter where you are and what that stage is. Overdose prevention does not mean that someone is a weak or bad person. My mom has told me I could use her story, and some of you have heard me share it before, and I apologize for that. But my mom, I think this was probably when she was about 85 years old. She has had to deal with chronic pain for the majority of her adult life. And she's on gabapentin. The nurses in the room will be able to appreciate this. Oxycodone, and she has a fentanyl patch. So when she walks into a doctor's office, goes up to the ER or anything like that, they look at her and automatically it's like, here, go pee in the cup. You know, you're drug seeking or anything like that. Well, she suffered from an opioid overdose. And it probably was well-meaning daughters not wanting to see her in pain, not realizing that someone else had already helped her with some medication. We didn't know. This was before I really knew what this was. Now in hindsight, it's like that's exactly what we saw. This can happen to anyone. Definitely individuals that are using opioids, maybe not for medical purposes or even for medical purposes. They act different on everybody. Some people you will see that, boy, it really gives them a pick-me-up. My mom would tell you it does absolutely nothing except maybe dulls her pain a little bit. Not everybody is going to have the same reaction. And it does work so much that if we get used to it, we want to have it because the withdrawal symptoms are horrendous. And my mom said, because hers was instant withdrawal, and then because she had been on opioids for so long, and they were doing a lot better work than she thought, because when she found out it was completely out of her system, that temporary part, I heard her screaming from the ER room, and she wanted her life to be taken because she couldn't handle that pain. So I think a lot of times individuals that maybe have an addiction to opioids, I think the ones that continue to fight are some of the strongest people I've ever met, because they're still trying to continue on with life. And we really need to erase that stigma around that. And I think being here and next door helping us understand some of these things is a way to do that. Again, our situation with my mom, she was extremely lethargic, and then started to notice breathing, the difficulty on that. 911 was called because we didn't really know what we were doing. And they recognized the signs. And so they were able to administer that right away. But what you might, because it's very important to know what to look for before you administer it. But you can do no harm if you administer it. So if you're like, hey, I don't know if this person is, but I happen to have one of those black packs in my car, I'm going to go ahead and administer naloxone or NarCan. You can do no harm by administering it. So it might be, hey, maybe it's methamphetamine. Maybe they're passed out because of alcohol. If there's some of these signs, or just for safety, and you have this, go ahead and administer it. Signs, person unconscious, not breathing, or very little, not very much chest movement. It's a different kind of snoring. You've probably all heard snoring before. This is a different kind. It's a kind of gurgling kind of noise, and that's what it was like. That rattling was different. Again, their lips inside of the mouth might be blue or grayish in color. Again, that's because they're not getting oxygen. If any of those happen, trying to wake that person, make sure you put someone near and say, call 911. And then you're going to go ahead, and hopefully you'll have this in your pack. And thanks to my buddy Rebecca from One Community Health, she's given me the little sample. So actually we'll pass this around and you can see how easy it is. It looks just like the ones that'll be in your pack. You are going to easily peel this out. It's much easier than plastic bags in the grocery store that you're trying to come apart. Very easy. You'll pull this back, You're just going to insert it in their nostril and put the plunger all the way up. What usually happens in an emergency situation like this is we're told that you want to wait about 90 seconds to 2 minutes. Well, if you see someone you care about and they're not breathing and you think this might help, 90 seconds is forever. Try to wait that long, but in the meantime, if they're not, that's where you could be giving rescue breaths. And I know for some people that's kind of scary to be able to do, so we wanted to make sure in these packs, which you guys will get, we have gloves to help protect you, and we also have, it'll come in a little red or blue pouch like this, little keychain, and this can help you feel more confident and secure as far as giving rescue breaths. You can put this over their mouth, and then you're going to breathe into it, covering their nose, just like you learned in first aid. But that's going to help you feel more comfortable. It's like, oh, I don't want to touch their mouth, or what if they throw up or something like this. This is going to protect you and that person. The things about the NarCan, and they've started to make them much more temperature. They're not hot and cold. They're not quite as sensitive to that. But again, if you know, hey, I'm going to be out and about and I have it in my car, my glove box, you might want to take it out, because if it's in sustained heat, 120 degrees, what can get in your car really easily, that can make it maybe not quite as effective. And then also extreme cold temperatures. But again, they've worked really hard on this to make sure it's a little bit more not as sensitive to temperatures. So you've waited, which seems like 5 weeks, for that 90 seconds to go by. If that person is still not revived, go ahead and give them the second one. Put it in the opposite nostril. And they've done a lot of research, and they say the average overdose that is needed is about 1.5. So you hear about these, man, I need 8 or I need 12. Most likely what they found is people were not waiting, which is completely understandable. Again, you're seeing someone that you care about, or you're just even someone that you want to help. 90 seconds is forever. But give it a chance to work. And then what's really important, that person might revive, but that does not mean that they're out of the woods. That means it's temporarily, that overdose is temporarily suspended. So we really want to encourage people to go ahead and go up to the ER. The Good Samaritan law, and some of you may have heard about that. But the great thing about the Good Samaritan law is it protects you as a person that's helping. Or maybe you were in a situation where, whether you were using also or you were just a bystander, you call 911, you don't have to have the fear of, I'm going to be prosecuted, I'm going to get in trouble for that. Because right now the most important thing is saving that life, and you are protected legally. So the Good Samaritan law, that's really important that we have that. And again, all of this is based on helping you feel more confident to be able to go and help save that life. Because we can't get people to treatment, to get people to recovery, if we can't do those things in the moment when they need us the most to be able to revive them. And at that point in time, there's no judgment. And really at that point in time, there shouldn't be any judgment. There needs to be understanding. So that's what I'm really grateful for, our partnerships with EOCIL, and Lupita will have a chance to be able to explain the great work they're doing. Our partnership with One Community Health, the great things they're doing in the community, and the Next Door. A couple things, we've kind of talked about this. The only thing I haven't really brought up is that, you know, when you're waiting to be able to put them in that rescue mode where they're on their side, that helps to make sure that they don't choke. We've had people ask, because you could see things on TV or in movies, when that person comes back, are they just really wild and things like that, and you have to be afraid. You have to realize that the state, when they get revived, they're probably not going to feel good. So expect that and help calm them down. It can be very scary if that person happens to be someone in a uniform. That might be really scary. But again, I feel like in our community, have excellent law enforcement who they carry this stuff, and they don't carry it for them. They carry it because they want to help. And we've had several instances. We were talking about a call that we had this last week where we've had our law enforcement agency says it's amazing when you can help bring a life back. One of the myths, especially with fentanyl, we've heard a whole lot about fentanyl. We like to do these trainings because fentanyl is an extremely dangerous drug. Well, Thank goodness when my mom started to get some help, I had to tell, when she was in ICU in Salem, I had to tell the doctors, I said, you need to start getting her back on fentanyl. And they just were like, who are you to tell me? And it's like, I know my mom, and you're going to be able to medically give it to her and watch. And that's when she started to come back. And it was a great restart to her life because she hasn't been as dependent on any of those medications. Still is in chronic pain, but she's finding other ways. And we don't pay attention to the doctor that just says, well, just take up your pain meds, because we've seen what can happen with that. We did a training out some of our gas stations, because the gas stations attendants were afraid to take money because they assumed their potential of someone who had maybe been using fentanyl or passing around could have that on the money on their hands. It's extremely, very, very rare. It would take a long exposure to have that be on the hands. You'd have to have a pretty decent open wound. It's not impossible, but also as far as like, you walk into a bathroom and you can see a foil and it looks like drug paraphernalia. You don't have to worry about, I got to get out of here, I only have 5 seconds to live. Those have, it reminds me very much of when we had the scare with AIDS. No one knew about it, so everybody was paranoid and scared. We do need to be very aware, because unfortunately, fentanyl is not any longer, it might be in fake pills. It's most likely going to be in fake pills. You can almost expect that. And we do have people that we've given out NarCan packs and said, I want 2 because I know I'm going to be using fentanyl tonight. And they've built up a tolerance. So for them, it's like that doesn't necessarily kill them like we see, one little grain of salt on the pencil is going to kill people. The other things with some of the fake pills, and we are not seeing as many of those. So that's some good news that I want to let you know. It's still out there. There have been a lot more things that are happening as far as education. Young people, they've kind of been putting the clamps down on some of the social media. Snapchat got itself in trouble because a lot of young people were able to purchase fake pills off that. We're getting more education. But America uses the most drugs of any country in the world. The other myth, and we just got this reinforced, is a lot of people saying there's a very good chance that marijuana, cannabis can be vaped and fentanyl can be in that. There are no anything that's confirmed that marijuana and especially in a vape, fentanyl doesn't have the same, it loses some of its potency when it's burnt. So again, I really don't want to go into schools and say, hey, don't be vaping. I want to say that, don't be vaping, but not be saying that, there could be fentanyl in it. Because as soon as those kids hear, well, no, there's no documented case, then it's like, what else am I lying to them about? One little kind of story, again, this is a local one. And then if you have any questions, we had a local store that had a young person, probably in their mid-20s, had struggled some with addiction, but really was getting their life on track and was working. And it was getting late and the people were going to close up. And this person oftentimes would clean up the store before they locked up. And so the owners were like checking everything, and they heard snoring in the bathroom. And they thought, he just probably has fallen asleep. I'm not going to worry about it. He's just tired. He's been working, burned the candle at both ends. And they didn't know. And they came in the next morning, and this person had passed by an opioid overdose. Now it's like, I wouldn't have just thought it was just snoring. When I hear that, I'm just going to do a double check from now on. So the more we learn these things, the more we can be prepared to help. Because as you guys all know, every single life is valued. And who knows when someone is going to be ready. And this whole conversation, they haven't hit their rock bottom. I think we need to get rid of that saying. And let's make sure no one ever has to hit rock bottom, whatever that is. We know we recently lost a life because someone was trying to administer NarCan, and they were grabbing one that had already been used and they couldn't figure out. So again, those things we just don't want to have happen, and we don't need to because we do have the resources.